Epilepsy is a disorder that's characterized by a tendency to have recurrent, unprovoked seizures. So anybody who has 2 seizures that are unprovoked in their lifetime is considered to have epilepsy. My name is Dr. John Wittman. I'm a neurologist with Neurological Associates. I do general neurology and have a subspecialty in epilepsy and sleep. The Epilepsy Monitoring Unit is a specialized unit that we have for people who have refractory seizures. It's a unit where people come into the hospital and we try to actually see what happens when they have a seizure. When people continue to have seizures despite taking medication, or if we're not sure based on the history whether it's a seizure or not, we bring them into the hospital. They have EEG electrodes put on their head and we record their brain waves and we have them on video for 24 hours a day. Sometimes we take them off of their seizure medication and we try to see what happens when they have a seizure. Neuropsychologists can be helpful for people who have epilepsy. A lot of people with epilepsy have problems with depression and anxiety. A lot of people with epilepsy have memory trouble. Some of that's due to the seizures. Some of it's due to the brain problem that causes the seizures. Some of it is due to the medications they take. As a neuropsychologist can help them work around some of those issues. Some people who cannot get their seizures controlled with medication are candidates for epilepsy surgery. And some people have seizure types that are not appropriate for surgery. They may have seizures that come from different areas of their brain. Well, I like working at St. Mary's because it's the first place in the community where we've been able to open an epilepsy monitoring unit. I get to see my patients on a daily basis there and get to really see what's going on with their seizures. And it's the only place in the community that we were able to do that. Well, I like doing epilepsy because we can make people's lives better. And most of the time we can get people's seizures under control with medication. So it's satisfying in that regard, and people can get back to work and back to driving and doing the things that they need to do.